I think technology can help solve most of the problems that we have, especially in healthcare and in education. I do love technology, but it's not about the technology. It's about the smart use of the technology in order to enhance how we do things, especially how we do and how we teach healthcare. Paradoxically, I think healthcare can be improved and made more humane by the smart use of the technology. I always talk about how the most important qualities of a physician are mercy, empathy, compassion. Those are things that technology will never be able to do, but we can enhance and allow us to rescue that part of medicine by using the technology in a clever way. If we think about technology has evolved, if we think about, for example, the first cell phone that was invented by that guy, Marty Cooper, in the 70s, and how this cell phone or smartphone, not really quite smart yet, it was able to storage 30 phone numbers, and that was considered a lot to what we have now, right? These devices like the iPhone, a smartphone that was created only a few years ago in 2007, and how this device has more computing power than probably the computers that send men to the moon. So we really have to really wonder. Right now it's all about digital health, it's about wearables, it's about devices like the Apple Watch, which can check an EKG and have an AI algorithm that can detect whether it's normal or abnormal. We have devices like the Fitbit Sense that can do the same, and these devices can also measure pulse oximetry and temperature and activity and whatnot, but especially they can connect to the cloud and make our health overall better by AI analysis of big data. So devices like the Oura Ring, that is also pretty fantastic. You can not just check activity and how you sleep and having a sleep algorithm that helps you sleep better, but also check your temperature and beyond. So all those devices, in a way, because we use them in a smart way, can improve how we do healthcare. If we think about devices that can allow us to go into virtual reality, right? The Quest 2. That is a device that you probably all know, a device that allows us to immerse in a digital world. This is part of the armamentarium right now in healthcare. We can use VR as a new weapon in the surgeons, in the healthcare provider armamentariums, in order to heal people, to treat pain or anxiety or PTSD or whatnot. So it is pretty phenomenal what is happening out there. If we look at what Google Glass did just a few years ago, right? I call it the Model T of augmented reality glasses. I was able to connect a couple of students remotely to what I was doing in the operating room, and that caught a lot of attention, and that in a way catapulted me to be a sort of a paladin of exponential technologies in healthcare. Devices now like this new blade, the View 6 blade, that is really a powerful healthcare tool in a way to allow us to connect to other providers, to do augmented reality, to connect to the internet, to message, to pretty much do anything in order to empower us, to enhance us, to augment us in order to do a better healthcare. Devices at the point of care ultrasound, for example, like the IQ Plus device from Butterfly, that allow us to do an ultrasound by connecting it to our smartphone and also connect it to an AI-based cloud that makes us better. Compare that device to a big ultrasound machine that costs thousands of dollars. Devices like the Echo stethoscope that I use frequently when I am examining, especially during the pandemic. I'm examining patients and I don't need the tubing. I can connect this device with my ear pods, and also having an AI algorithm detect whether the patient has a murmur or not, and help me make a better diagnosis, help me in a way become a better physician. Two devices like the HoloLens, which is a magnificent computer head-mounted display, right, that allows us to do computing in this space, right, manipulating that digital realm, that digital reality in ways that we never were able to do it before. So this is the future of healthcare, but it's the future of healthcare here today. To finally, devices like the mighty Magic Leap, right, a device that will become a tool for digital health, for digital surgery, to do computing in this space, to allow us to immerse ourselves in the metaverse, in the magic verse, by manipulating the desktop in this space. So unlimited possibilities. We see what Brain Lab and Magic Leap are doing with the mixed reality viewer, for example, allowing a better education of the patients, better diagnosis, better planning of the surgery, and even treatment with the guidance that extended reality allow us to do. This is really phenomenal. So I think that today is a very important time. I think that we are at the cusp of a major revolution in healthcare, and I think that it is really an honor to be a part of this. So I hope we stay connected, and I hope that we can continue to discover new ways to enhance and augment how we do healthcare by the smart use of technology, without forgetting that compassion, empathy, and mercy are the most important